Hello and good afternoon and welcome to today's presentation of Healthy Bones for Life. We're so pleased to have you join us today. My name is Ann Marchetti and I'm the Program Manager for Public Health and Policy here at Bone Health and Osteoporosis Foundation. While everyone settles into the webinar, I'd like to cover just a few housekeeping notes to help the webinar run smoothly. There are several of my colleagues assisting in the background to help address questions and answer any comments that you have. We kindly ask that you post your questions in the Q&A feature so that we don't miss anything and we get a lot of questions. So if you could please locate the Q&A and utilize that function. If you don't receive an immediate response, our peer educator, Sandy, will likely address your question at some point during the presentation or during the Q&A. And we'll also be posting links to program materials in the chat box, and that'll pop up for you when we post those materials. This webinar is being recorded and a replay link will be emailed about 24 hours after today's event. And we send along the slides and other links mentioned during the program. We hope you took the pre-event knowledge survey before today's event. We appreciate your time in completing that short survey. So I am very pleased to introduce our speaker today. Her name is Sandy Ullman, and she is a trained peer educator, and she volunteers to educate communities about bone health. And we greatly appreciate our volunteers and value their expertise and commitment to bone health. So Sandy, I will let you take it over.
Okay, thank you, Ann. Hello, and welcome to the webinar, Healthy Bones for Life. My name is Sandy Ullman, and I am a trained bone health peer educator. I want to thank you all for joining us today, and I'm pleased to present this program to you. Just to share a little bit about myself, I recently retired after working 38 years as a physical therapist. Because of this and my family history of osteoporosis, I have seen firsthand the impact that osteoporosis can have on an individual and their families. That is why I wanted to get involved with BHOF's program to assist with educating the public, since there is so much that can be gained through knowledge to aid with the prevention and treatment of osteoporosis. Please take a moment to review the health-related information on this slide. The medical information we share in this program is provided as an informational resource only and is not to be used or relied on for any diagnostic or treatment purposes. Please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. We are not able to answer any questions about an individual's health condition or needs. The nutritional recommendations in this program are based on U.S. recommended daily allowances and for people that are in average good health. If a person has a specific health condition, it may impact absorption, and it is recommended consulting with a bone health specialist for individual nutritional requirements. Later in the program, you will have the opportunity to practice some exercises with us. If you choose to practice with us, please do so safely, staying within your own comfort zone. Bone health is important, and we feel everyone should have the personalized bone health plan included. So this would include understanding your personal fracture risk factors, knowing your 10-year risk fracture by taking the Bone Health and Osteoporosis Foundation Fracture Risk Calculator, talking to your healthcare provider about your osteoporosis risk factors and getting a bone density test if necessary, and then determining which, if any, risk factors need to be addressed. The talking with your healthcare provider provided in the related content will help you prepare for the discussion. Being active, getting appropriate physical activity by practicing bone-safe exercises and proper body mechanics. Eating well, by including a variety of bone-healthy nutrition. Preventing falls, by taking steps to improve your balance, strength, and adjusting your living environment. Taking medication, if your healthcare provider determines it is needed. Today's program, Healthy Bones for Life, is a program that touches on all the components in the Bone Health Plan, designed to give an overall basic knowledge about these components. Attend one of our other programs where we can take a deeper dive into each of these topics. Osteoporosis or bone loss is significant, silent, and sadly can cause death. There are more than 2 million preventable fractures every year. That number is expected to increase to 3 million in 2025. Compare that to other health problems like breast cancer, heart attacks, and strokes. You can see that the number of fractures is more than those health problems combined. We must all make bone health and fracture prevention a priority. Osteoporosis affects men and women from all racial groups and can rob people of their independence and quality of life. But the good news is that osteoporosis is very preventable and treatable. Today is a great day to take actions that will improve your bone health for your lifetime. By the end, I hope you will understand why bone health matters to you now and what you can do to keep your bones strong. What is osteoporosis? How we diagnose it, and how to slow bone loss. The factors that contribute to bone loss and osteoporosis, how to prevent falls that lead to fractures, and treatment options available. Throughout this talk, we'll provide links to our downloadable handouts. They are available throughout the presentation and will be posted in the chat. And we will provide them to you in the follow-up email, along with the replay link of this webinar. Finally, we will touch briefly on the current treatments that are available to prevent fractures. So let's learn how to keep our bones strong and healthy so you can live a long and independent life by talking about your bones. Osteoporosis is an epidemic in this country. If you remember nothing else about what I say, please remember this. Osteoporosis is a serious problem, and this is why. 70% of people with osteoporosis have not been screened, so they are not aware that they have osteoporosis. Now let's take a quick poll. You should see a poll pop up in your screen in about 30 seconds, and you can answer yes or no. Have you received a bone density test? Okay, wow, this is fantastic. We have 98% of those attending today that say yes, they have had a bone density test. That is fantastic numbers. If you or someone you know that has been putting off the DEXA scan, early screening is really important. So especially if you have one or more of the risk factors. So nice job, everyone. That was fantastic. Let's begin by talking about your bones, bone mineral density, and osteoporosis. It is easy to think of bone as a hard, lifeless part of your body, but bone is living, growing tissue with old bone being removed and replaced with new bone. Because of this process called remodeling, where osteoclasts break down bone and osteoblasts build bone, the bones that you have now are not the same bones that you had 7 to 10 years ago. And they will not be the same bones you will have in 7 to 10 years. This gives you the possibility of improving your bones, and that is really exciting to know that information. In healthy bones, the osteoclast and osteoblast activity is balanced. When this remodeling becomes unbalanced, in other words, when removing bone happens faster than replacing bone, bones can become thin and fragile. Throughout their life cycle, bones are built, broken down, and rebuilt. This is the life cycle of the skeleton. Throughout childhood, the osteoblasts, which are bone-forming cells, are working faster than the osteoclast cells, which break down bone. The skeleton grows very rapidly during the teen years until peak bone mass, around the age of 30. Once you reach peak bone mass, the remodeling process stays balanced. The osteoblasts and osteoclasts are working at the same pace and bone mass stays relatively stable until around menopause for women and about age 70 for men. At menopause, because of the decrease in estrogen, the osteoblasts do not keep up with the osteoclasts, and there is a rapid period of bone loss. And you can see that demonstrated on the slide. During the 5 years around menopause, women can lose as much as 15 to 20% of their bone mass. Men continue to lose bone density at a steadier and slower rate than women, and at about age 70, the reduction in their hormone levels begins to cause more rapid bone loss. Understanding how bone develops helps us understand how we can prevent osteoporosis. There are very important things we can do to support our skeleton throughout our lives. Kids need to build as much bone density as they can in their teens during the years around puberty 9 to 14. They will build more bone density than they will lose in their entire lifetime. Today, we will talk about what you can do to help optimize and preserve bone density and limit behaviors that are bad for bones, which can set you up for having a fracture in the future. There are many risk factors for osteoporosis. Some you cannot change. Gender. 80% of people who have osteoporosis are women. Women have a higher risk of osteoporosis than men due to their lower estrogen levels as they age. Genetics. About 60% of bone health can be attributed to genetics. If your mother or father had osteoporosis, you are at a higher risk yourself. Age. As we age, our risk increases. This is considered primary osteoporosis, age-related osteoporosis. Fracture risk, yours or your parents. And if you have a low impact fracture, your chance of having another fracture increases. Finally, medical conditions and medicines. There are a number of medical conditions and medicines that can affect the bones. I'll show you a list of the most common in a few minutes. We can't do too much about these risk factors, but it is important that you are aware of them so that you can take extra steps to minimize their impact. We have a handout available for download titled Osteoporosis. It can happen to you, and taking charge of your bone health for more information. The good news is that there are a number of factors that you can control. Getting enough calcium and vitamin D, not smoking, increasing physical activity, especially weight-bearing activity, improving posture, and making sure your body weight is appropriate are also important to protect your bones. Before going on any medicine, it is important to talk to your healthcare provider or pharmacist about how it might affect your bones. There are many medical conditions and the medicines to treat them that can cause bone loss. This is a list of the most important conditions. If you are diagnosed with a chronic condition, you should ask your healthcare provider if bone loss is a concern, so you can increase your prevention strategies. Some medical conditions and their treatments can cause bone loss. Excessive alcohol consumption. Cancer and its treatments, including radiation, chemotherapy, surgical treatments requiring removal of the prostate, ovaries, and parts of the colon or stomach. Cushing's disease is when the body produces too much of the hormone cortisol. Diabetes, both type 1 and type 1 and type 2, increase the risk of fractures from excess blood sugar and how it affects the collagen in the bones and the medicines used to treat diabetes. Eating disorders, serious untreated hormone deficiencies, including sex hormones, estrogen and testosterone, parathyroid disease, and hyperparathyroidism. Taking a high dose of thyroid medicine for thyroid disease of greater than 250 micrograms per day for many years. Long-standing malnutrition or malabsorption, including lactose intolerance, celiac or Crohn's disease, and bariatric weight loss surgery. Chronic liver disease, organ transplant, mostly due to the use of the immunosuppressant drugs for life. Rheumatoid arthritis, RA for short, carries both the risk of osteoporosis and the risk of fracture. RA's inflammation contributes to bone damage, possibly by stimulating osteoclasts, which are the bone cells that deplete bone minerals. Prednisone, a corticosteroid drug used for decades to control inflammation, is one of the notorious culprits in bone mineral density loss. There are many medicines that can cause bone loss. This list is only a snapshot. We have another handout available for download titled Medicines That Can Cause Bone Loss. You should see a link to this resource in the chat. If you are taking any medicine currently or start a new medicine, always talk to your healthcare provider about how it may affect your bone health. How can you find out about health of your bones? There are many ways to screen for the risk of osteoporosis and bone loss. There is a difference between screening and making a diagnosis of osteoporosis. Screening tools only lead to a diagnosis. The only way to diagnose osteoporosis is with a bone mineral density test, or DEXA. One of the most important things about DEXA is that it is typically the defiant first step to clinically management of the disease. Definitive, excuse me. Any of these screening tools could help indicate the risk of the osteoporosis or fractures and should prompt a diagnosis with a DEXA. Height loss with abrupt change of 1 inch or more in a year can signal fractures in the spine. Wrist fractures and low impact fractures may seem insignificant, but they can be an important signal that the bones may not be as strong as they could be. Peripheral screening tests, as noted in the recommendation statement of the U.S. Preventive Services Task Force, include peripheral DEXA. This uses radiation to measure BMD at peripheral sites, such as lower forearm and heel. Quantitative ultrasound, or QUS for short, uses ultrasound to evaluate peripheral bone sites such as the heel. Finally, there are a number of fracture risk calculators available for the bone health assessments. The BHOF fracture risk calculator is available on the website. Notice that a standard X-ray is not on the list of tools to diagnose osteoporosis. Standard X-rays can detect a fracture, but are not good at detecting bone loss. A bone loss of at least 40% is necessary for it to be detected visibly by a radiologist on a standard X-ray. The gold standard for diagnosing osteoporosis is a DEXA, called dual energy X-ray absorptiometry, which is X-ray technology. This test is also referred to as a bone mineral density test or bone density test. This measures the amount of bone density, usually in the spine and hip. It is simple, painless, and takes about 15 minutes. The scanner uses a very small X-ray beam to capture images of the bone in your lower back and hip. It uses about 1/10 of the radiation of that chest X-ray. That's less radiation than you'd be exposed to on a coast-to-coast flight. When you get a bone density test, the results are reported as a T-score. That's a statistical measurement. The T-score tells you your bone compared to a healthy person at peak bone mass at around the age of 30. A Z-score compares your bone density to the average bone density of people your own age and gender. A T-score is reported as a standard deviation, SD for short, which tells you how far you are from zero. A standard deviation of 10% and is used to describe the ranges for many tests. If a T-score is between -1.0 or greater, it is classified as normal bone density. If a T-score is between -1.0 and -2.5, it is classified as low bone density, also known as osteopenia. If a T-score is -5 or lower, then it is classified as osteoporosis. A T-score is between normal and osteoporosis, is classified as low bone mass. This is not pre-osteoporosis. This means that it is 10 to 25% less bone density than an average person age 30 at peak bone density. There could be many things that prevented an individual from reaching their optimal peak bone mass. The point is that bone density is only one part of a person's bone health picture. It is really important to keep a copy of your bone density tests. Since bone density changes pretty slowly, you want to be able to compare your results when you have follow-up tests. Take your DEXA result with you to get each healthcare provider visit. Bone density is only one part of your bone health picture. There is an additional software program called TBS, Trabecular Bone Score, that is available on some DEXA machines that gives a reading of bone quality or bone strength. You can ask the facility that performs your test if they have TBS software and find out if you need an additional written prescription from your physician. Be aware that there is an additional charge that your insurance company may or may not cover. I know just recently I had my DEXA scan done earlier this year, and that was the first time that I actually had a TBS score also. So definitely worth asking. It seems that like a lot of providers are incorporating that also now. The T-score only tells you about your bone density. What we're also concerned with is your risk of a fracture. What we know from the National Osteoporosis Risk Assessment, called NORA for short, which is a longitudinal observational study showing results where fractures happen at all bone densities. Bone density accounts for only about 30 to 50% of fractured risk. In fact, the majority of fragility fractures occur in people without osteoporosis, as defined by bone mineral density. Some of the other factors that are part of the risk equation include age, race and gender, body mass index, medical conditions and medicines, lifestyle, fracture history, yours and your parents. Although osteoporosis is a silent disease, there are ways that you can learn your risk of a fracture. A low-impact fracture from a fall may seem insignificant, but it can be an important sign that your bones may not be as strong as they could be. I had a patient that was referred to me that she had tripped and fallen, and her doctor was like, you know, for your age, I just don't think that you should have fractured your wrist with that. So she went ahead and did DEXA scan and did more testing, and this patient ended up having a thyroid issue. So, you know, it's something definitely to bring up. You know, if you are starting with a new provider and you've had a fracture and they're not aware of it, it would be really good to bring it to their attention so they can follow up with it as necessary. Abrupt height loss of more than 1 inch in less than a year can signal fractures in your spine. Make sure to get your height measured at every healthcare provider's visit. Another way to know your risk of breaking a bone is to use an online tool called a fracture risk calculator. The calculator generates a risk level based on your age, BMI, or body mass index, bone density T-score, if known, and medical conditions. These are the risk factors you saw on earlier slides. You can use the BHOF fracture risk calculator on the website. A link is provided in the chat, and the link is in the follow-up email. Now that we know about osteoporosis and how to diagnose it, let's talk about what we can do to prevent bone loss. We need good nutrition with adequate calcium and vitamin D, physical activity to keep our bones strong, and taking prescription precautions to prevent falls and reduce fractures. In today's talk, we won't have the time to cover these topics in depth, but other bone health programs on these topics that will go deeper. Please check the schedule on the website for the upcoming sessions of Eating for Healthy Bones, Freedom from Fractures, Stepping Out Strong, and Posture Power. Let's talk about the top nutrients to support bone health: calcium and vitamin D. Please note these recommendations are based on US guidelines. Guidelines may be different in other countries, so please check with your healthcare provider. Calcium is the principal mineral in bone. It's what makes bones strong. Nerves and muscles also need calcium to function. And if calcium is not available in the bloodstream, the body will take calcium from the bones. To maintain a good level of calcium in the blood, people need between 1,000 and 1,300 milligrams every day. This equals about 2 to 3 servings of a calcium-rich food. The best dietary source of calcium is dairy. In general, you get 300 milligrams of calcium in a serving of dairy or a calcium-fortified food or juice. Unfortunately, many people are lactose intolerant and need to find other ways to get calcium. There is calcium in vegetables, but in much smaller amounts, and you must be aware that calcium binds to the fiber in the vegetables and is not as easily absorbed. Pay attention to food labels and look for foods that include calcium. We'll look at the food label in a moment. Be aware of how much calcium you need to eat every day. Remember, 2 to 3 servings of a calcium-rich food should help you meet your daily requirement. If you cannot meet your daily requirement through food for your calcium, you may need a calcium supplement. How do we know if we are getting enough calcium from our food and if we need a supplement? Reading food labels can help you make healthy choices and has different sections worth noting. In the first section, look at the number of servings. The nutrition facts panel shown on the screen is based on 1 serving. In this example, if you eat the whole container, you will get 2 times what's listed on the label, including the calories. Secondly, reduce or limit your intake of added sugars, saturated fats, and sodium. Less than 5% of daily value is considered low. In the second section, try to make choices where the daily value is low. The third section includes vitamins and minerals that you want to keep high. A daily value of 10% or more is considered a good source. A daily value of 20% or more is considered an excellent source. The calcium and vitamin D daily values on the nutrition label are higher than previous Institute of Medicine recommendations. The daily value for calcium increased several years ago when the food label was updated and was mandated from 1,000 milligrams to 1,300 milligrams. However, the actual milligrams amount is also shown, so you do not have to do the calculation, which is always nice. The daily value for vitamin D on the food label is 20 micrograms, or 800 IUs, an increase from 15 micrograms, which was 600 IUs previously. Vitamin D and potassium are mandatory on the nutrition facts label. Americans in general are not getting enough vitamin D and potassium, and a deficiency can result in health problems. Vitamin D also plays an active role in promoting immune function, which can help protect against infections and disease. Potassium is an essential mineral that helps regulate fluid balance and is needed for a healthy heart and nervous system. If you do not get enough calcium in your food, you may need a calcium supplement. Remember, your total calcium intake should be calculated from food plus supplements. Start by calculating how many servings of calcium-rich food you get each day, and then only add a supplement to get you to your recommended dietary allowance, RDA for short. There is no additional benefit of going beyond the RDA. There are also upper intake limits, which you do not want to exceed these amounts per day for calcium. And these amounts change actually with your age. The next time you are in your local drugstore, take a look at the calcium supplement display, it can be quite overwhelming. And that's why we're going through a few things today to help. What to know is there are two basic types of calcium supplements: calcium citrate and calcium carbonate. Calcium citrate is more soluble, and you can take it without food. Be sure to read the labels, though. You might have to take more tablets to get the right amount of calcium. Calcium carbonate needs the acid in your stomach to help dissolve the tablet. So always take it after you have food in your stomach. I always find it kind of challenging to remember which one needs food and which one does not need food with it. So one of the little tips that I kind of learned was calcium citrate. It kind of sounds like calcium citrus, citrate, citrus. And I think of a lemon that has more acid to break things down. So calcium citrate does not require food, but the calcium carbonate does require food to produce acid in your stomach to help dissolve it and get absorbed. Be sure to read the supplement labels, as some of the supplements contain vitamin K, and you do not want that if you are on blood thinners such as Coumadin. Don't take them with iron supplements like your multivitamin. The two can compete for absorption. If you take thyroid medication or a beta blocker, be sure to discuss your calcium intake with your healthcare provider. The body can only absorb approximately 500 to 600 milligrams at a time, so read the label and do not take more than 500 to 600 milligrams. It is important to note the suggested amount of vitamin D was previously expressed in IUs, which are international units. On the food label, vitamin D is reported in mcgs, which is micrograms. It is a mandatory nutrient, and the food label must list the amount of vitamin D in micrograms per serving and percent daily value. The conversion factor is 1 IU equals 0.025 micrograms. To be absorbed in the intestine, calcium needs vitamin D. Although vitamin D can be made in the skin when it is exposed to sunshine, the sun is not a reliable source of vitamin D for most people. To maintain a good level of vitamin D, people need anywhere from 15 micrograms to 50 micrograms, which also equates to 600 to 2,000 IU units a day. For healthy adults, the National Academy of Medicine suggests 15 to 20 micrograms or 600 to 800 IUs. However, if you have a metabolic bone disease such as osteoporosis, the Endocrine Society suggests a higher level, up to 50 micrograms or 2,000 IUs per day. Work with a healthcare provider to determine your individual needs. Your vitamin D level can actually be checked with a blood test. There are a few food sources of vitamin D, particularly fatty fish, but most people need to take a vitamin D supplement. As you can see on the slide, some foods containing vitamin D are fatty fish like salmon, sardines, dairy such as milk fortified with vitamin D. Other foods include fortified cereals and juices, proteins such as an egg yolk. But notice there are no fruits and vegetables on this list. See the handout called Calcium and Vitamin D, the dynamic duo for bone health, which includes a reference chart on recommended daily allowance and do not exceed daily amounts, covering both calcium and vitamin D. Regular physical activity has many benefits for bone health. To stimulate bone building, physical activities need to be weight-bearing. The higher the load, the better. To build bone density, you must do activities that load the bones with 4.2 times your body weight. This is called osteogenetic loading and is the amount of force needed to stimulate osteoblasts to build bone. Basically, you can remember that activities that strengthen muscles will strengthen bones. The loads on the skeleton vary by exercise. Let's take a look. The load that you put on your bones vary by the kind of activity you do. And we think about load as multiples of body weight. The more body weight or load involved in an activity, the more effective on bone density. The numbers on the left of the chart represent load on the body and bones. When you swim or cycle, you are not adding any body weight or gravity or load to your bones. Walking or brisk walking loads 1 to 2 times body weight and can help prevent bone loss. If you run, jog, or jump, the greater impact with the ground loads 3 times your body weight. To build bone density, you need loads of at least 4 times your body weight. You can get this by jumping, or you can also do strength training, which loads your bones in a different way. Check with your healthcare provider or physical therapist to determine whether jumping is appropriate for you based on your fall risk and bone density. We have another handout available for you titled Bone Sense and Osteogenetic Loading. A link to this resource is available in the chat. It is critically important that you load the bones safely, especially if you have low bone density, osteopenia, or osteoporosis. The spine bones, especially the smaller bones in the thoracic spine between the shoulder blades, are particularly vulnerable when you are rounding forward because you are overloading the weaker front portion of the vertebrae. Fractures happen when the load on the bone exceeds its strength. If you do not use proper body mechanics, you can cause a compression fracture. As you look more closely at the picture, you can see what part of the vertebrae the compression fracture has occurred. This is called the vertebral body. This is where we can lose height in our spine. Earlier, we talked about height loss with an abrupt change of 1 inch or more could be a sign of osteoporosis. Well, this is the reason why. In fact, I had a patient that was referred to me who went to her doctor because her grandson had commented that he thought she had actually shrunk. Her doctor ordered a DEXA scan, and indeed she had osteoporosis and had suffered a compression fracture. So that is just something to be aware of. We don't always think about our height when it comes to compression fractures, but it is definitely something good to alert your physician to. To support your spine bones, always use great posture and great body mechanics when you exercise and do daily activities. I'll just give you a few cues that you can incorporate right now, just as we're sitting for posture. Couple of quick things. Just think of yourself as being 2 inches taller. That lengthens the spine and it kicks in the back extensor muscles. Or think of like a puppet string being pulled and you're being lengthened toward the ceiling. The other thing is we've got our collarbones, and you can think of the collarbones as spreading your wings, and that will help kind of lift up this part of the chest. And then you can also tighten up your belly button towards your spine. Those few cues right there improves your posture immediately and kicks in your posture muscles to assist. And you get the benefit of strengthening them at the same time. Okay, make sure you make sure to keep your back straight, bend at the knees, and hinge at the hips. I will be discussing and demonstrating hip hinging later during an exercise. Stretching the muscles in your chest and strengthening the muscles between your shoulder blades can help protect your spine. Finally, good strength, core strength, can also protect the spine. And this gets kind of tricky because you want to avoid exercises like crunches. That can actually be very damaging. And that's what a lot of us have heard in the past, that is what we've relied on, but it can be very detrimental when you have osteoporosis or osteopenia. One of the best core exercises is the plank. Even when done on your knees, it will help build core strength. We spend a lot of time hunched over our devices, steering wheels, and counters. This exercise can help improve your posture by strengthening your back muscles and expanding your chest muscles. Put your hands up and out to the side with your elbows kind of parallel. I'll push back a little bit more. You can maybe see a little bit better. And I like to take a deep breath first. So take a deep breath in. And as you exhale, squeeze those shoulder blades together, and you can feel them contract, and hold for about 3 seconds. Usually as you're breathing out, if you go breathe out slowly, it's going to be a 3 count. Then breathe in and repeat. Squeeze the shoulder blades together as you breathe out. Breathe in and repeat. And you can feel those muscles contract, and they're going to help stabilize the spine and give better posture strengthening for you. What's so nice about this exercise is that you can do this multiple times throughout the day. So if you find yourself in a position where you're a little bit more forward, attending to things in front of you, this would be a great exercise to incorporate throughout the day. When you strengthen the legs, you will reduce the risk of falls and fractures. Strong thigh muscles keep you independent. And this is a really important one to keep in mind and try to do. And what's so nice is you don't need any special equipment. So you can first test your leg strength by attempting to get out of your chair without using your arms. If you would like to attempt this now, please do so safely. I will also be demonstrating this exercise in getting out of a chair without using my arms, so you can better have an idea of this. But I'm going to actually go through this exercise first, and then I'll push back and demonstrate. Stand close to a chair with your feet hip distance apart. Keeping your back straight, hinge at the hip, squatting back and hovering over the chair. Hold this as long as you can and work your way up to 30 seconds. This is a great indicator of your leg strength. Strong legs help prevent falls and fractures. Okay, so I'm going to push back and just tilt this a little bit. So hopefully you can kind of see. All right, so I've got my chair here. We're going to first just do a sit to stand without my arms. So I'm going to just cross my arms in front of me, and I'm doing a stand and then coming down to sit. It's a really good demonstration or way you can test at home how strong your legs are. If you cannot do a sit to stand without using your arms, it's something that you can just work on that in itself, but it is an indicator that you definitely need to work on your leg strength. So what a lot of times I'd have people do is, if you cannot stand up without using your arms, go ahead and use both arms, but really push off strong with your legs. Then you can decrease to maybe only needing one hand to stand up and come back down, and then eventually get to no arms. So that's one way of looking at it. But the big thing is just being aware and conscious of actually pushing off with your legs, not relying on your arms as much to do the push off. The other thing you want to make sure is that you're doing it from a chair that does not slide, and that sometimes you can push it up against a wall. That's beneficial. Or the other thing I've had, if you have really a lot of difficulty with your sit to stands, you can actually do it from a bar stool and have that bar stool pushed up against the wall. But you can start at a higher height and work on that and then gradually go to a lower height. So now we're going to demonstrate the squat. So basically, you want to make sure, again, that your chair, because if you're coming down and you're doing your squat and then going to rest, you want to make sure that the chair is right there and you don't miss it. So make sure you reach back and make sure that chair is present before you do the activity. When you are going to do the squat, your feet should be shoulder width apart. And when you are coming down, you can decide where you want your hands at. But when you come down, you're going to kind of feel like you're kind of poking your bottom out and you're lifting your chest up. And I'm going to just change this a little bit here, excuse me. So when you are coming down, you can see where I'm hip hinging here. This is where I'm doing the movement, and I've got my palms up so that I'm feeling where the groin is. And sometimes I would refer to it as a panty line, but basically that's where the hip hinge occurs. So when you're coming down into the squat, you're going to hip hinge here. So you kind of feel like your bottom is poking out a little bit, or you're poking your bottom towards the chair. And then you're going to spread those wings, your collarbones, and that lifts the chest up, or squeeze those shoulder blades together, the ones that you learned about when you did the W form, and hold that position. You can put your hands wherever you want, and then you try to see if you can hold that for up to 30 seconds. But that's a really good exercise that you can do. And the benefit of it is that you can do it in increments, meaning you can only come down part way to begin with, only a few inches, or as you get stronger, then you can go even further down. But you can individualize this exercise to meet your needs. And it can really make a big difference, because think of how many times we go from sit to stand in a day. And if you were more aware of using your legs more when you did do a sit to stand, or let's say before you sit down, you hold that position a little bit and do your squat, you can get multiple repetitions in a day. And it's very, very functional. So it's a great exercise to do. Balance is critically important for your bone health. If you have good balance, you are less likely to fall. Did you know that balance can be improved with practice? It is important to practice balance every day. If you incorporate a simple exercise such as balancing on one foot while brushing your teeth, you will notice a difference in a short time. Begin this exercise by holding onto the counter and standing on one leg. You know, if you also incorporate it after an already established habit, research shows that you have a better chance of incorporating it more into your day or developing that habit also. So for example, let's say you get coffee every morning. You pour your coffee. Well, you're right at the counter. Go ahead and do this exercise. I wouldn't suggest using or holding your coffee as you're doing it, but this would be a way you could easily incorporate it, or as they, have also suggested, just every night. Every morning when you're balancing, brushing your teeth, do it then. Every night when you're brushing your teeth. So it's really, if you take the time to figure out when to incorporate it into your day, it really can make a difference and it can add up. There are many things you can do to prevent falls around your home. Check the carpets. Make sure any carpet is firmly attached in the whole house, or remove the carpet. Are the carpets loose or torn? Do they have so much padding that it's difficult to feel the front edge of the carpeted stairs? An alternative to carpet on the stairs is to remove the carpet and install non-slip rubber treads. Throw rugs are one of the most common causes of falls in the home. There is a handout for download called Home Safety Checklist, Ways to Prevent Falls at Home, that will provide more suggestions. We've done exercises to improve our posture, leg strength, and balance, but we always want to take precautions to prevent falls. There are an estimated 2 million people who fall and injure themselves enough to go to emergency room, and 500,000 result in hospital stays. Having good lower body strength and balance can reduce your risk of falling. There are other ways to reduce your risk for falling. Stop multitasking, slow down and pay attention to where you are walking and what you are doing. And again, I've seen examples of this. I had a patient referred to me that she'd been doing her daily walking down the hallway at her apartment complex. She was adamant about getting so many steps in a day, and she was doing fantastic. Did not require an assistive device, a cane or a walker. And however, she had her phone in her pocket, and she was expecting a phone call, and it was kind of an important one to her. So she was reaching in her pocket when the phone rang when she was walking. She didn't stop. She just continued walking because then she was trying to get to her apartment so she could have a better conversation. But it got caught, and so she was kind of pulling, at her sweater, and pulled it out. Well, she ended up losing her balance, and she suffered a significant fracture of her femur, her thigh bone. And, it can happen. And so I just want you guys to know that, really when you are walking, try to pay more attention and try not to multitask, especially like looking at your phone or texting. Stop and do that. And it just will make you a lot safer. Take a look around your home. Do you have throw rugs that are all over? Pick them up and put them away. What about pets? Of course, we love them, but remember that they love to hang around our feet and easily knock us off balance. Keep your eyes open for them. We have a cat named Pepper who knows every morning what time, she eats, and every night. And boy, do we get some serious loving, rubbing around our legs. And honestly, there's been a few times where I've tripped because of our cat. So I've actually been even more cautious and even hold on to the countertop, do those kind of things, just because you don't want something like that to happen. And we definitely love all of our pets. Speaking of eyes, then we also want to get our eyes checked. That is something that vision plays a really important role in preventing falls. Our brains rely heavily on our vision, and so to guide us, to help our body respond to our environment. So if we can't see well, how can we expect our body to respond? Most falls happen at night, and guess where? Usually in the bathroom. Get a night light and use it. If you're taking 4 or more medicines called polypharmacy, you are at a higher risk for falls. Talk with your healthcare provider about the medicines you are taking, and if all of them are necessary, make sure you are not interacting, making sure that they are not interacting with each other in a negative way. We have talked about all of the things you can do to prevent bone loss and fractures, but if you are high risk for breaking a bone, you may benefit from a treatment. How do you decide to start treatment? Treating osteoporosis is like wearing a seatbelt. There are about 2.3 million adults who go to the hospital from car accidents and about 2 million preventable fractures each year. Wearing a seatbelt reduces the risk of serious injuries and deaths by about 50%. Taking a treatment for osteoporosis reduces the risk of fractures by about 50%. The risk of seatbelt injuries from car accidents and serious side effects from osteoporosis treatment is very small compared to the benefits. If you are at high risk of having a fracture, you will benefit from a treatment. Determine your risk, discuss your options with your healthcare provider, and decide what's best for you. There are many treatment options available. They have all gone through rigorous testing and have been approved by the FDA. There are very few side effects and are effective at reducing fracture risk. Your healthcare provider can help you understand what might be best for you. All the medications on this list have been thoroughly tested and approved by the FDA. For more information, you can look at FDA approved treatments page of the website. All of the medications on the list you just saw are FDA approved. They are all effective in preventing fractures and reduce the risk of future fractures by approximately half. All medications have side effects, but the risk of rare adverse effects is significantly lower than the risk of having a life-alternating fracture. Medications are made in different ways, and the terminology can be very confusing. Some are chemical compounds. Many medications, such as aspirin and the bisphosphonates, are made from chemicals and have relatively simple chemical formulas. Generic medications are made from chemicals to copy a brand name medication. Generic medications are tested and compared to brand name medications in studies. But biological medications are made in a different way. Biological medications, such as insulin, are made from living sources that use cells or tissue, such as yeast, bacteria, or animal cells. The U.S. Food and Drug Administration approves biologic medications to treat many different chronic conditions, including osteoporosis. Two biologic osteoporosis medications you may have heard of used to treat osteoporosis are denosumab and romosozumab. A biosimilar is a type of medication that are very similar in structure to an original biologic medication. But biosimilars are not considered generics. Because of their complexity, they are not manufactured in the same way as traditional pharmaceuticals. But like generics, biosimilars are FDA approved. Both have been tested and compared to brand name medications in studies. Learn more via the BHOF handout, Understanding Osteoporosis Medication, Biologics and Biosimilars, and consult with your healthcare provider about your option. I hope you have learned a lot about how to keep your bones and body strong so you can avoid fractures. We've covered a lot of bone health information, so here are the tips to remember from today's session. Know your T-scores and keep a copy of your bone density tests. Know your risk for breaking a bone and get tested and diagnosed. Get adequate calcium and vitamin D. If you can't get enough calcium from your food, you need a supplement. Many people need a vitamin D supplement. Perform weight-bearing and balance exercises every day. We've done a few simple ones today that are easy to work into your daily routine. We'd like to know what you have learned and what you think about this program. You will receive a survey link in the post-event follow-up email to post-event knowledge survey so we can understand how much you've learned during the program. We wish you your feedback on the surveys to improve the educational tools and resources. We'll use your feedback for that, and all answers are anonymous. The survey only takes about 3 minutes. Thank you for your participation. Stay in touch for the most up-to-date information by signing up for the newsletter. connecting with us on Facebook or Instagram, or emailing info@bonehealthandosteoporosis.org. Thank you for attending this program. Please help end fractures and osteoporosis as a major public health problem. Thank you.
Hi, Sandy. That was great. Thank you so much. It looks like we have all of our questions answered. There was one that just came in that we'll just briefly touch on before we wrap up here. Someone would like to know if they can use walking sticks.
Oh, yes. Walking sticks actually are beneficial. A couple of things is you just need to make sure that the walking sticks fit you properly. So you can even, wherever you go and purchase them, or you can look online a little bit more as far as what kind of height you want. But when we walk, we alternate. We have with a normal walking pattern, our right arm goes forward as our left foot does. And then we alternate the other way. So with a walking stick, it's kind of nice because you do that alternating gait pattern. And the benefit of it too is that you're kind of pushing down through the ground, and it also kind of helps kick in your back posture muscles better. And so it helps you keep your alignment a little bit better, especially if you're going on for a longer hike or longer walk. It can be beneficial in that manner. A couple of things too, if you are doing more of a hike where you've got a little rougher terrain, definitely would advise using them. So yeah, we found them quite beneficial because it actually kind of facilitates those back muscles and your posture to kick in. But just make sure you know how to use them properly and they're adjusted properly for you.
Well, that was a great tip. And thank you so much, Sandy, for the special tips and the demonstrations that you gave today. They were very helpful. And I really like the one about the collarbones and spreading your, treating them that you're spreading your wings. So I had not heard that one before, but I love it. So
Good.
I hope everyone has enjoyed the presentation today, and watch for the follow-up email tomorrow. Thank you.
Thank you, Anne.